Right. So today we're going to take a deep dive into some changes that are happening to Medicare. Medicare Part B in 2025. And this is something that's probably on a lot of people's minds right now.
Yeah, especially folks getting close to retirement.
Yeah, if you're getting close to 65, this is something you really need to be paying attention to.
For sure.
So our main source today is this CBS News article that came out pretty recently, actually. November 11, 2024. So it's pretty up to date. And it's titled, Seniors Will Pay More for Medicare in 2025. Here's what to know.
All right.
So we'll link that in the show notes if you want to check it out yourself. But we're going to kind of break down the key points here and what it means for you and your wallet.
Absolutely.
When it comes to healthcare.
Yeah, when we think about Part B, it's interesting because it covers so many of the services that people think of as sort of their everyday healthcare needs. You know, we're talking doctor visits, we're talking outpatient care, even things like preventative screenings, vaccines, and even durable medical equipment.
Right.
So things that you might need, sort of unexpectedly so. It's a really important part of.
Oh, absolutely. And, I was just talking to a friend, and his dad had surgery recently, and he's actually relying on Part B.
Oh, wow.
For in-home health care, and it's really expensive.
Yeah.
And that made me think about this 6% premium hike.
Yeah.
That's coming in 2025.
That's right.
And it's a big jump.
It is significant.
Like we're talking going from $174.70 a month to $185.
Yeah, and it's interesting because that increase comes after we actually saw a decrease in 2023, which is kind of rare.
Which is unusual, right?
Yeah.
Yeah, so
what's going on?
Well, I think we have to look at the bigger picture.
Okay.
Healthcare costs in general are just continuing to climb.
Yeah. Seems like everything is more expensive these days.
Absolutely. There's increased demand for services, there's new technologies, the population is aging.
All these factors play a role.
Yeah, that makes sense. And it's not just the premiums either, right? The deductible is also going up.
Yeah, that's right.
In 2025.
From $240 to $257.
Yeah, so we're paying more upfront before Medicare even kicks in.
Exactly. It's that, initial hurdle you have to clear each year before Medicare starts really sharing the costs.
So to break that down, what does that actually look like for someone?
So basically, you're responsible for that first $257 of covered medical expenses out of pocket.
Okay.
And then once you hit that threshold, then Medicare starts sharing the costs.
Okay, now here's where I think it gets really interesting.
Yeah.
How this lines up with the 2025 Social Security CCO-LA.
Right.
Which is only 2.5%.
Yeah. So if your main income is coming from Social Security, your benefits are going up by 2.5%, but your Medicare Part B costs are increasing by 6%.
Wow. Yeah, that's a pretty big gap.
That's a gap, right? And that essentially means the buying power of your Social Security benefits is shrinking.
Yeah, when it comes to healthcare costs.
When it comes to healthcare, exactly.
Now, for those listening who are considered higher earners, this gets even more complicated.
Yes, it does.
Because of this thing called IRMAA.
Right. Income-related monthly adjustment amount.
Could you break that down a little?
Sure. So basically, if you're a higher income beneficiary and these income thresholds are adjusted each year, you're going to pay an extra amount on top of the standard Part B premium.
Okay.
So it's designed to ensure that those who can afford to contribute more do so.
So, for example, individuals earning above $394,000 in 2023, they're going to be paying a total of $628.90 per month just for Part B.
Wow.
In 2025.
Yeah.
Which is a lot.
That's significant.
So is this system actually fair?
That's a great question, and it's a complex one.
Yeah.
There are definitely different perspectives on this.
Right.
Some argue that it is a matter of fairness. Those who can afford to pay more should contribute more to ensure the stability of the system for everyone. Others might see it as a form of means testing where benefits are tied to your income.
Okay, so how does this all actually work then in terms of payments?
So if you're already receiving Social Security benefits, that increased Part B premium is going to come right out of your check starting in January.
So automatic?
It's automatic.
Okay. But if you're not receiving Social Security yet, but you are enrolled in Part B, you have to pay that separately.
That's right. You'll need to make sure you're paying that increased amount either online, by mail, or by phone.
Okay, so it's really important to be aware of these changes and plan accordingly.
Absolutely.
So we've talked about the premium increases, deductible increases, how it affects different income levels, and how those payments will work. But what does this all mean for someone who is, maybe approaching retirement or just starting to think about Medicare? Like, where do we go from here?
That's a great question, Abel. It can be a lot to take in. But I think, knowing what's coming is half the battle.
Yeah, that's true.
The good news is there are ways to plan ahead and potentially mitigate some of this impact.
Okay, that's what I like to hear.
Yeah.
So what can our listeners do to kind of get ahead of this?
So first and foremost, understanding all of your Medicare options is key.
Okay.
We've been focusing on traditional Medicare Part B,
Mm-hmm.
but there's also Medicare Advantage.
Oh, right. Yeah. My neighbor was telling me about Medicare Advantage.
Yeah, and that's offered through private insurance companies.
She was saying it covers stuff that traditional Medicare doesn't.
That's right. Medicare Advantage often bundles benefits, like dental, vision, and even prescription drug coverage.
So how do you know which way to go, like traditional Medicare versus Advantage?
It really depends on your individual needs.
Okay.
And your healthcare preferences.
Okay.
Medicare Advantage might seem attractive with those extra benefits,
Right.
but it often comes with networks of providers you have to stay within.
Mm-hmm.
Traditional Medicare offers more flexibility, but might mean higher out-of-pocket costs for things like prescriptions.
So it's really about weighing the pros and cons.
Exactly.
What about in terms of like financial planning? Like, do you have any tips there?
I think this is crucial. If you're nearing retirement, don't wait until you're 65 to start factoring healthcare costs into your budget.
Okay.
Assume those costs are going to continue to rise and plan accordingly.
It sounds like being proactive is key here. But, I mean, isn't there a limit to, like, what individuals can do?
Sure.
Like, these are sort of systemic issues driving these rising costs, right?
Absolutely. Individual actions can only go so far.
Right.
They can make a difference. Even something as simple as focusing on preventative care, regular checkups, screenings,
Right.
maintaining a healthy lifestyle that can potentially reduce the need for those really expensive interventions.
Right, like an ounce of prevention is worth a pound of cure.
Exactly.
Are there any resources or programs out there that can help people who are maybe struggling with some of these costs?
There are, if you're worried about prescription drug costs, there's the Medicare Part D Extra Help Program, which provides financial assistance for those who qualify.
Okay.
There are also patient assistance programs offered by pharmaceutical companies, which can help lower medication costs.
So there are options out there.
There are.
Even if it seems like a lot at first.
Yeah.
And I think knowing where to find accurate information is key.
Absolutely. Organizations like AARP and the National Council on Aging are excellent resources for information and guidance on Medicare and other healthcare-related topics.
So don't be afraid to reach out to them or even a financial advisor.
Absolutely.
Someone who knows this stuff.
Yeah, having a knowledgeable guide in your corner.
But, aside from practical tips, there's also that bigger picture to consider, right?
You're talking about the sustainability of the Medicare system itself.
Yeah, exactly. We've been focusing on individual strategies.
Right.
But with, the population aging, healthcare costs continuing to climb, are there concerns about whether Medicare can even keep up?
It's a valid concern, and it's one that policymakers are grappling with.
Yeah.
We need to think about how to balance providing quality, affordable health care for seniors while also addressing the financial realities of the program.
So what can our listeners do to kind of make their voices heard on this issue?
Being informed and engaged is key.
Okay.
Stay informed about healthcare policy. Contact your elected officials.
Yeah.
Join advocacy groups and let them know that this is a priority.
So it's not just about personal planning.
Mm-hmm.
It's also about advocating for that systemic change.
Absolutely.
Well, we've covered a lot of ground today.
We have.
From the specifics of those Part B changes to these broader questions about healthcare costs and their impact on retirement.
Right.
But I think there's one more crucial question that we need to ask. What impact will these rising costs have on our listeners' retirement plans?
Yeah.
Yeah, it's easy to get caught up in those the day-to-day details of Medicare.
Right.
But we need to kind of zoom out a bit.
The bigger picture.
Yeah, if healthcare costs keep rising like this, what does it mean for retirement?
I think that's a question everyone needs to be asking themselves,
Yeah.
How will these rising healthcare expenses affect your lifestyle?
Yeah.
Your ability to travel, pursue your hobbies, even help out family members.
Right. It's not about fear-mongering or anything. It's just about being realistic.
Exactly.
If a bigger portion of your income is going towards healthcare, something else has to give.
Right. And it's not just about those direct costs, the premiums and the deductibles. Right. It's about potential long-term care needs.
Oh, yeah?
The rising cost of prescription drugs, and even the possibility of needing supplemental insurance to fill in those coverage gaps.
So I think this all just really highlights how important financial planning is. Even for people who feel like retirement is still a ways off.
Couldn't agree more.
You know?
The earlier you start factoring healthcare costs into your retirement savings strategy, the better prepared you'll be.
And it's also about making those smart choices now.
Right.
That can impact your health later on.
Absolutely. Things like staying active, eating a healthy diet, not smoking.
Yeah.
You know, those things aren't just good for your overall well-being.
Right.
They can actually save you money.
In the long run.
By reducing your healthcare needs down the road.
Yeah. You know,
prevention.
It's about being proactive.
Yeah.
With your health and your finances.
And there's people out there to help. Right?
Absolutely.
Like, don't be afraid to reach out.
Don't go it alone.
Yeah.
There are financial advisors, Medicare counselors, organizations like AARP.
Right.
They can provide that personalized guidance and those resources to help you
navigate.
Exactly.
All of this. Well, we've covered a lot in this deep dive.
We have from the, nitty-gritty details of these Part B changes to the broader questions about healthcare costs in general.
Absolutely.
And how those affect retirement.
Yeah. And it can feel like a lot.
It can.
But hopefully our listeners are walking away feeling a little bit more empowered.
Yeah, I hope so.
A little bit more prepared to take action.
Not just power, right?
Exactly. The more you know, the better decisions you can make.
For yourself.
For yourself, absolutely.
And this is an ongoing conversation, right?
It is.
This isn't the end-all be-all.
No.
Like, talk to your friends. Talk to your family.
Talk to your elected officials.
Make your voice heard. Advocate for these changes.
Yeah, let's all work together.
Absolutely.
To create a system that really supports us in retirement and beyond.
Well, thanks for joining us on this deep dive.
My pleasure.
We hope you found it informative.
And insightful.
And until next time, stay curious and keep learning.
Absolutely.